I am Dr. Eli Camp. Welcome. This is my podcast, Vital Wisdom. And this is where I talk about health, wellness, homesteading, raising children, and lots of other topics, all from the perspective of vitalism. I believe I've seen and taught others how the body can heal itself if it's given what it needs, it's not poisoned, and the innate healing ability of the body has been supported, not suppressed. It is my intention to bring what I have learned in my life, especially the last 24 years of being a physician, to help you be your own best doctor. Hope you enjoy the episodes, and thanks for being here. Hi, everybody, and welcome to Vital Wisdom. I'm Dr. Eli Camp, and today I have a very special guest, Dr. Jason Kinley, who's up in Spokane, Washington. And as always, we're talking about vitalism, or the body's ability to self-heal if it has what it needs, and you get out what's poisoning it, and you stimulate that body's innate healing ability. It's always what we talk about on my podcast. And so thank you so much for being here, Dr. Kinley. Why don't you tell our viewers a little bit about yourself and your practice, where you're at, all that great stuff.
All right. Well, first, thank you, Dr. Camp, for having me on. I always look forward to having a chance to catch up with you. So I am located in Spokane, Washington. I have a private practice, Mountain View Vital Medicine, that I own. I'm the only doctor in that practice, but I do have a number of staff that assist me. And I have a very large family. I have 9 children, and we live on about 40 acres at this time. And when you're talking about vitalism, and that's what you discuss on your podcast, vitalism to me is a way of living. It is not a medical practice where we choose to practice one way, we step out, and we then go to living a different lifestyle. And that's essentially what happens in the conventional world. Is here's the information, and we want you to treat either with a pill or a surgery or whatever. But then once we walk away from the office, we live differently so that we can manage disease instead of eliminate disease. And so when I take patients on, we've kind of restructured the way we take patients. We've become more selective, because what I've found is that I really want the patient who's motivated. It's not a dollar figure. It's a motivation piece. Somebody who says, I cannot stay where I'm at because I'm too miserable, and I am ready to change my entire life. And those are the patients I'm really finding joy working with, as well as my staff. And they get significantly better because they do the work. Because as we know, the word doctor comes from the word docere, which means to educate. And I say this repeatedly all the time. A doctor's job is not to fix you or heal you, because even a surgeon cuts out something or puts something in, and then the innate wisdom of the body must continue the process to the end. It is not the doctor. So that is where I really practice with my patients of all ages. Unfortunately, we're seeing people get sicker and sicker in general, due to things you mentioned earlier: environmental toxins, food choices that we're making. Air quality is terrible for a variety of reasons at this point, being manipulated, etc. So that's just, a little bit about what I do and how I think, at least out of the gate.
9 kids. The whole thing you just said, I know my listeners are going to be going, 9 kids, holy moly. How do you feed all those kids?
What's interesting is we tend to try to grow our food. Last year was a little difficult between weather, and we actually had the fortunate experience. I was in Europe for about 2.5 weeks, and my wife was there. My 2 oldest were there. And the youngest, who's just over a year now, was with us. So we didn't grow as much last year, but we try to hunt. We buy in bulk, and we make a lot of our food. And what I will tell you is that when people eat a clean diet, you eat less food because your body is more efficient at what you're putting in, at using it. So you don't have to eat as many calories. And so it's about the quality and understanding that. And when you really do it, my wife and I were talking about this, I don't know, a month ago, 2 months ago. She said, we went on a reset after the first of the year. A lot of people will. We started in February. And she went, okay, I really calculated out the food budget. And when we really dialed it in, it was actually less expensive to eat organically and eat clean than if you don't. And it's not that we weren't before, but we just brought a few other things in, but we actually saw the bill drop because we made sure we were very intentional after the holidays, right? And it dropped compared to before the holidays, right? Because everybody could say, oh, it was the holiday. No, it dropped. So that's because, and everybody felt better because you just cleaned everything up. So feeding them is, again, part of the lifestyle. My oldest daughter now is really good at bread making. So she's 16. She makes the majority of our bread, and she makes it, every couple of days. And we don't eat bread every meal.
Right.
Like there's this thing, right? You don't need to have grains every meal.
Right.
So we have it at dinner, if we have it at all.
Right.
So that's just how we feed them. As we try to hunt, we have our own livestock. I realize that's not possible for everybody.
Right.
So that's how we do it.
Yeah. Well, it's very similar to us. So we buy in bulk. We have a 30,000 square foot community garden where we can get most of what we need out of that, with some extra for our community. But yeah, bread, cheese, everything's from scratch. And, we try and eat with the sort of new revised food pyramid where fruits and veggies are at the bottom of the pyramid. And then you step up into meats and seeds and nuts and oils. And then you step up right into grains at the top, just at the tippy top. Because I think people forget that you can get protein, carbs, and fat from lots of fruits and veggies, and
Yes, you can. Absolutely.
They forget that.
Yeah. And we've got this weird shift where, you shouldn't have a lot of fat in your diet. And
what's up with that?
And how many people have gallbladder problems because the gallbladder doesn't exercise because you don't eat fat, right? If I eat fat, I get fat. That's not true at all. For my patients, I want them 50% of their diet to be fat because it sustains them, and they end up eating less because they're satiated. So they end up consuming fewer calories throughout the day, keeps blood sugar more stable, all of these things.
Right.
And then they don't have to eat 6 times a day, right?
Oh,
There's
exactly.
and we've taught people, especially if you have blood sugar issues, oh my goodness, you better eat 6 times a day. Time out.
Right.
Your digestive tract doesn't rest when you do that.
Right.
So eat 6 times a day, and if you exercise 20 minutes a day, that's enough.
Yeah. Right. Whatever. No,
it's not enough movement in a day. It just isn't.
No.
So
I tell people the same. I don't do quite that much fat. I do 40% complex carbs from fruits, veggies, whole grains, things like that, seeds, nuts, legumes. And then I do 30-30 on protein and fat. But that's interesting. So just for those of you who don't have, a official training in nutrition, the reason why fat works like that is because it provides more calories, right, per serving than protein, and it's a complex molecule that your body can use for energy. And so it lasts a long time, and your body doesn't burn through the energy that comes from fats as quickly, and that's why you're not as hungry as often, and it sustains you. Well, that's really cool. So I've known you for a long time now, and
I know.
I can't believe it's been so long. We're going to get to see each other here just in a few weeks. And, people, I think, get really curious about how different doctors practice. And I've had a number of guests on the show where they've talked about, oh, well, this is my approach. And you said something really important when we started, that really what you're looking for as you sculpt your practice and as you let people into your practice are people who are motivated. And
Yes.
maybe talk for a minute about that. What does that mean to those people out there who are thinking, oh, I want to change the way I do my health? What does motivated mean?
Motivated means they have a pain point, right? What we know is I don't care what it is. Maybe it's health, maybe it's work, maybe it's education, maybe it's your house is a mess. Whatever it is, right? Most people do not make a change until they're dissatisfied with where they are and they say, that's it, I can't do it. What happens in my practice is a lot of people come in and that's where they are, but they don't realize how bad it is. And they don't know that there's a different way forward. So my job is to understand where somebody is and how is this really affecting what your life is like. And if I can understand that, I can then paint a different picture for you. But if you don't understand where you are, you just realize, yeah, I got this problem, right? So here's a primary example. I had a patient come in a week ago. He and his wife, he's 60 something. And he said on his paperwork, oh yeah, my primary concerns are digestive. But he was on 2 medications, one for diabetes and one for cholesterol. Those weren't a concern for him because they were managed in the system, but he didn't like the drugs. But he didn't put it as a complaint because nobody's given him the reality that you could get off of those things. Mm-hmm. So when I sat there and just explored it, he went, wait, I can do that? Absolutely you can, but you have to do it. I will teach you how, mm-hmm. right? Mm-hmm. So that's what I'm looking for. It doesn't mean you have to, be perfect right now.
Right.
It's that you're ready to really make the change and commit to yourself and whatever it is, your kids, your grandkids, your wife, whatever you're looking to do, you have to be ready to commit to you because it's hard to make these kinds of changes. So when I look for the patient, that's what I want, is somebody who really is like, So what I do is I sit down and I interview the patient. And if you're not a good fit, I pull back and I said, you know what, you're not ready, or this isn't the place for you, and that's okay. So I don't take everybody anymore because, people don't understand that, but what I do is not what you're getting. If what you're getting is okay with you, I'm not the place for you. Yeah. And it can't be like, oh, well, I'm kind of okay with it. No, you have to say, I am not okay and I'm done with this.
Yeah.
And that's what we want, because now I work with patients for 3 months or 6 months or 9 months consecutively. And my staff, when we bring you in, you're like our family. Mm-hmm. Because you work with all of my staff closely. So we want to be able to make sure we can help you, right? The other piece to what I've done and realized the longer I've done this, and this is going to be potentially controversial for people, but you know me well enough to know that there's a surprise, right? If you have a chronic illness, I don't care who you are or how old you are, 25 to 30% of the problem is emotional at a minimum for almost any chronic illness or disease. And it doesn't even mean, people go, wait a minute, I hear this all the time. Well, I went to counseling. I worked through this.
Right.
It's what I call a somatic memory. Your body holds on to it, and that changes your physiology and changes your actual DNA. We know that from studies. So I work on a level where I don't need as much lab testing. I order it because the patients are still stuck and it helps them see, so they have that side. The more complicated the case, the more mental emotional there is. The less complicated the case, the less mental emotional. So that's why I'm saying 25 to 30% at a minimum.
Yeah.
I've had really chronic cases that are 80% mental emotional.
And they don't know it.
Right. Yep. And that's what we point out in the interview. I'm like, wait, did you? And they're like, oh, exactly. Because your body produces a hormone. If we want to get scientific, whatever that means anymore in this day and age, we know the body makes a hormone under stress called somatostatin. And that hormone is inhibitory to thyroid, gastrointestinal tract, pancreatic function, adrenal gland function, blood vessel repair and formation. So if you have those challenges and you operate there for 5 years, 20 years, 50 years, your body is suppressing and your body functions that way. That means from childhood. So when we ask about childhood, it's not because like, oh, what does this have to do with anything? It has everything to do with it. In so many cases, we just have parsed that out and said that can't affect where you're at 50 or 60 or 70.
Well, yeah, mainstream medicine does not do a really good job of connecting the dots of someone's life story and how they got to where they are from where they began. It's a disconnect, right? They're like, oh yeah, you know what happened to you at 3 couldn't possibly have affected you now. And I think I find with people, they're just not really sure how good things could be.
Right.
They don't understand what life looks like when your body has healed itself and you're functioning from a place of health.
Right. Yeah, because we've been told the best you have is managed care. That guy was a prime example. You're managed. Okay, I'm good. Really?
Really?
That's interesting to me. So what would your life look like if you didn't have these problems? You'd be amazed at how many people can't answer that question.
Well, because I don't know. Right?
Every week I try to help walk them there, and they're like, well, I wouldn't have this. Well, if you didn't have it, what does that mean? Well, I don't know. Well, let's explore that. What things did you used to do that you can't anymore? What things do you want to try that you haven't been able to? And when you start walking down the path, all of a sudden it's like, well, I would go here and I would do this and I would, okay, well, let's get you there. Maybe it's going to take us 2 years.
Right.
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 And the other thing that I have seen is that there's a lot now because of functional medicine. And that term, it's a double-edged sword, right? So here's my take on functional medicine. Functional medicine is a great initial starting point to get people to realize there's a different way. Okay. That's my take on it. The drawback to functional medicine, people need to understand where it came from. It was born by naturopaths. There's a whole nother story, but naturopaths at Bastyr trying to teach conventional providers how to think outside the box. And what happened? The conventional system had way more money to throw behind their terminology. And so now everybody wants a functional medicine doctor. Here's a problem I have with that. Yes, you're going to get a different approach in terms of their attempt, which is great. Yes. But they're going to order thousands and thousands of dollars in lab work. And then they're going to give you the supplement to treat the lab instead of going, I don't think that lab actually means much in this case. And if we fix this, so for example, if you have digestive problems, you're going to have problems on your labs.
Right.
That's it. Why? Because you're going to have nutritional deficiencies. Why? Because you don't absorb well. It doesn't mean labs don't have some value, but we are now looking at MCAS, mast cell activation syndrome. Oh my goodness. It's triggered by mold, by Lyme, by chronic infection. How did you get the infections? Right?
Exactly.
What else was going on? And what I have seen is folks that have come in with these really unusual symptoms, and the ones that aren't willing to do the work, they don't improve. Or they hit a spot where they get really uncomfortable because of the mental, emotional. They get stuck, right? It doesn't mean we don't employ nutraceuticals. It doesn't mean we don't use supplements. It doesn't mean we don't. I do some IV therapy. That's controversial in and of itself, but
if it's needed.
Well, and that's the thing, right? Not every patient gets it. It's not that like, okay, great, it's nice to see you today, Eli. We're going to give you an IV for the next 6 weeks. Why? Well, because it'll be good for you. Time out. What can we do with food and some other things first? Right? So we'll start there. So we're not saying that we don't ever use a higher level of intervention or that there aren't utility, but so many people are coming in with all of these issues, and it's lab test, supplement, high dose, whatever. And there are a handful of cases where those are the things that are really needed. But I will tell you, after working with people, the ones that are the most difficult are the ones who are not able to face the mental emotional piece.
It's a
It's
big
just
part.
it's huge.
Yes. And for those of you hearing this thinking, oh, well, I don't really have any mental emotional stuff. I'm just fine. It's like a storybook, once upon a time. You have to start at the very beginning of the story. And sometimes I have found that people don't realize that they've been through trauma or they've been through something that has created a mental emotional imbalance. They don't even know
Right.
it because
Right.
you're born into a family, or maybe you're not born into a family, you're born, and what is around you, the things that happen to you, the people you interact with, this is your normal world when you're young. And as you grow and you mature and you realize that that's not the only kind of world that exists, some people might say, hey, I wonder if my normal world affected me in some way. And some people just, well, I call it martyr syndrome. They come in and everything bad has happened to them, right? And they don't realize that they can change their life by changing the way they think and feel, and correcting that. And sometimes you don't have what you need. Well, no, I'm not going to say that. We always have what we need inside, but you don't realize what you need to do to sort of set those things back in balance.
Yep.
Yeah. So, so what kinds of things do you do in your office with folks? I know you do a really great interview with them, thorough and in depth, and identify
Mhm.
their places that have gone wonky. But what kinds of, people often write in questions and say, well, what do you think about, hyperbaric oxygen? And I have this little pre-written reply that the therapies that we use is not as important as what each person actually needs and what their body actually needs to help restore health, including what they eat, how they sleep, the water they drink, right? But
Yes.
people are curious about some of the tools that we have. What do you do in your practice?
Well, before I get into that, I want to give somebody a opportunity to do an exercise that I did recently. So I have a business coach, and I will tell you, and Eli knows, anybody that wants to be successful, whether it's with your health, with farming, whatever, you have a mentor, you have a coach,
Yes,
right?
I agree.
So here's an exercise for people who are like, well, I don't have any trauma. Write your own obituary.
Oh,
When
that's
we
interesting.
So we had to do this as an exercise, and then it was okay when I was writing it, and then I volunteered to read it out loud, and I got stuck halfway through. I couldn't finish reading it. I broke down, and it was like, wow, I haven't moved past that. And
Right.
I didn't realize that that was still a challenge. Like, some days I knew it, but I didn't realize how big it was,
Yeah.
and it just came out, and it was like in front of, I don't know, 250, 300 people.
Wow.
And it was like, oh my goodness, like I had to pull it together to finish it. So if you think you don't have anything, really try writing your own obituary in terms of, and just see, one, can you even do the exercise?
Yeah.
And two, if you get through it, read it out loud, even if it's to yourself,
Yeah.
and see what happens. Because you might suddenly realize, oh my goodness, this was intense. And I'm telling you from experience, I knew there was going to be something. I was like, yeah, it really, and after I got done, I was like, whoa, I was drained. And it was really
Interesting.
unusual. So I just wanted to kind of put
Yeah.
that out there for people to explore that. So as far as tools, botanical medicine, botanical means herbs. Herbs come in a lot of form: liquid, whole plant, powdered, capsule, whatever. So you don't just go, well, I have an infection, you give golden seal. I'm going to use that because a lot of people just assume, you got to have golden seal. It's considered by many to be nature's natural antibiotic. I don't look at it that way. Um, yes, I use it because it's antimicrobial, but I don't give it out that often, because if it were true, I still don't want to use an antibiotic, right? There's this concept of anti. anti means against. Well, antibiotic is non-specific, will wipe out good and bad. So I have to be judicious in my use of particular plant material. Same thing with essential oils. Essential oils, there are brands out there that put it in all their products. And let me tell you, there is no such thing as pharmaceutical grade, folks. This is a marketing ploy.
Yeah.
Okay. Pharmaceutical would actually technically be in what's called the USP, United States Pharmacopoeia, doesn't exist for essential oils. So don't use pharmaceutical grade to mean anything. It's their marketing gig.
Yeah.
So now you're taking essential oils internally.
Ugh.
Oh, it's great. It helps. Yeah, it's anti. It will kill good and bad.
Right.
We need to think about this. So that's the herbal side of things.
Before you go past that. So, we've learned through the Naturopathic Medicine Institute that we use botanicals when we have to use them, but we still ask the question, well, what about this person's body allowed this quote unquote infection or microbe to find such a wonderful home to flourish and thrive?
Right.
Right. So I want to remind people of that. Well, we're talking about the tools. You always have to remember a healthy body is number one.
Right.
Number one line of defense if you want to think about things out there, attacking you, which I don't think like that either. But yeah.
Right. Well, and the other problem we have with that now is because we know, for example, that COVID was manipulated through gain of function research.
Yeah.
And they're looking at the same problem with the bird flu and whatever.
Yeah.
We're having man-made problems that are not going to respond to our natural therapies the same way. Why? Because it is not a natural problem. It is an unnatural problem. Exactly. So that means you have to take even more accountability for your health, because the conventional system, if they created the problem, they won't be able to solve it.
No.
Right? It's a Pandora's box. We are seeing folks with, COVID vaccines, and we're having to really reach outside the box to try to help solve, which can be done, but it takes longer and it's not easy.
Yeah.
And so really what you're saying about you have to be accountable, exercise, diet, lifestyle. When we talk about, for example, microplastics, okay, there was some studies done recently, but people don't think about this. And what they're not thinking about is the microplastics, when they did post-mortem, they found microplastics in the kidney, the brain, and the liver. Out of those three, do you know which one had the highest deposition of microplastics?
No.
The brain. More than the liver and kidney, and those are your filtering organs. So here's what I'm saying. When you go through your drive-through coffee stands, they have microplastics in those cups. When you use those plastic straws, if you have a Vitamix, I love Vitamix, but what's the container? It's plastic. They sell stainless steel containers, but they're not the standard. You have to buy them, right? Yeah. What are your water bottles? Oh, disposable water bottles, terrible. Not only are they plastic, but you're going to leach the plastic if they heat up into the water. And we know this. People microwave in plastic. Dear Lord, you're microwaving in plastic, let alone the fact you used a microwave. So when we're talking about, well, which botanical am I going to use? If you don't remove those obstacles to cure that you can change first, we're just maintaining and treading water. It doesn't matter the tool that I grab.
Right.
You have to do these foundational pieces. And that's why when I go back to the interviewing process, I need to know that you're ready when I say you got to stop your microwave. Because I had a patient years ago and they quit seeing me because they weren't willing to do the work. And that's why I changed my practice, right? Well, we're going to start with, I don't even know if we can stop microwaving. Then you're really not interested in changing your life.
Right.
Right? You can say, I don't understand it, but I'm willing to try it. I get that. But to say no, when we've got all the data and the research, in fact, the American Academy of Pediatrics put out a paper, it's probably 8 years ago now, maybe a little bit longer. In there, it talks about all the problems with contaminated sources from food containers, and the negative health outcomes. But do they give those out in pediatric offices? No, but it's from them.
Well, it doesn't even change the way they practice.
No.
It's there's that research that was done. Okay. All right. So we have botanicals.
Sorry. Yeah.
Is that your favorite?
Actually, it's not.
No.
My favorite is becoming again, controversial, trigger point injections known as biopuncture using
Ooh,
saline and homeopathics. And here's why. You're great with homeopathy.
I am.
Dr. Camp is great with, like, you want a homeopath with great skill set? She's amazing. So what I've discovered, though, is that somatic memory, I can unlock those using the trigger point biopuncture. And I've developed it enough at this point that I may end up teaching a course on it.
Oh, that would be awesome.
So what I'm doing with the patients is I can figure out where they're locked in the back. And then we'll go through and assess okay, I've got this problem. And now I've learned how to ask certain questions. And when we go through it, they're like, okay, it brought this up, it brought that up. We do the injection. And it stemmed from a case of a guy who had been in the Merchant Marines and broke his back. And originally I was doing biopuncture only for pain relief.
Okay.
And it was a great way to do it because they had a lot of chronic debilitating pain. There's no drugs in it, so we don't get the reaction. I like it better than prolotherapy, if you're familiar with prolo, because prolo is dextrose, lidocaine, saline, and I don't like the dextrose and lidocaine in there.
Right.
And all of a sudden he had nightmares after we did the injection. And I went, that's interesting. And it was about the accident.
Oh,
so
wow.
It brought it up for him. And I said, okay, and this was years ago. I said, okay, let's try it again. And then he had a different set of dreams. And so about a year later, I had a lady come in. We had worked together for a long time and we resolved everything except for her gut. And this is the testing issue. And this is the tool set issue. So we had run all the stool testing, the food assessments, everything. Every problem she had was better except for her gut. And I said, okay, I'm missing something in your story. Let's go back. There was a problem with her dad. And I said, okay, so tell me about that. Oh, well, I got this pain in my shoulder and okay. So we worked through, I started my initial assessment with her on the table and I check her back and she's like, yeah, that's my dad. So I inject it. She's like, oh, now I got problems on the other side. That's my mom. I inject it. Now it's back onto the other side. It's my dad, but now it's something different with my dad. Okay. So I inject that spot over there. And she's like, man, now I got this pain in my low back. Didn't have that earlier, right? Strange, bizarre, but not in our world. It's just interesting. So I go and I inject the spot in the low back and she breaks down in tears, like uncontrollable on the table. And I was like, this freaked me out just a hair because I hadn't seen this yet. And I said, okay, are you okay? She goes, yeah, it doesn't hurt. She's just in the process of sobbing. I had this big release that just went through my body. She got up off the table. All of her stomach pain was gone.
Oh, wow.
And I was like, okay, so let me, so I started to play with this and I have developed, I just had a lady recently come in. We did hers. She never told me she was abused. And when we did a set of the injections, she's like, I can feel the spot. And she started crying. She's like, I can feel the abuse again. But now she was letting go in a safe space because there was no actual threat.
Right.
And she got up and she's like, I feel so much lighter. So this has actually become one of my favorite tools because it's allowing us to address the mental emotional that the body is holding on to while giving pain relief, and it allows us to process without having to go through all the details. One of the things people don't like to do is to talk about every single aspect. Most people don't, but I have found it to be more effective really than counseling on a number of my patients. And that has allowed us to move the needle faster. So that's one of my favorite tools. My favorite tool is the Carroll method. You've probably had other docs on that use it. It's the food intolerance method that I use. And that's what got me into naturopathy. What got me doing this was actually being a patient years ago, decades now, I think at this point. And that's what changed my life. And we haven't had this part of the conversation because I didn't know until a year ago. I was so sick when I was first married. Emily told me, my wife, I didn't know how you were going to provide for us because you were always getting sick.
Oh, wow.
And so until I had the Carroll done, we couldn't figure it out. And when I had that done, all of a sudden I stopped getting sick. And she just told me this about a year ago, that she didn't know how I was going to take care of the family. So
that's a good wife. She didn't destroy your confidence.
no, right?
Right.
So that's the thing. So food is number one. hydrotherapy is critical. So I do cold plunges. If you go to my Facebook page, you'll see I was breaking the ice in December and January and jumping into my pool because of the benefits of cold water therapy.
Yeah.
If Father Knipe would say that's too extreme, but that's okay.
Yeah.
So food, water therapy, and trigger point injections have actually become my favorite treatment modalities, but not everybody gets the trigger point. Everybody gets food and water therapy, right? They're safe, they're cost effective, and it teaches you how to treat regardless of the circumstance. It's always going to be critical. So those are my favorite. I use homeopathy. I've had amazing results with homeopathy. We brought in, so this is where I merge science and vitalism. VO2 max testing. I don't know if you're familiar.
I've heard just a little bit about that.
Okay, so I used to live in the world of exercise science and wellness, health promotion, injury prevention. That's what I was doing in undergrad, so decades ago. And when I started, we used to do VO2 max testing when I was in an undergrad, but you had this big set of lab equipment, and it was really expensive, and it wasn't cost effective, and you would do it for clinical trials, or you might do it if you were a super high performance athlete and they had to test the access to the equipment. So I have now brought in VO2 max testing into my clinic because now you can there's a device that I use called Pnoe, which is Pnoe. I'm the only one in my whole area within like 5 hours that does it. And what you do is I do an exercise test and a resting test. The exercise and resting give us different metabolic information. So cell function. The exercise test can give us your chronological age. So how old are you physically? And then your cell health and biological age. So for example, I had a lady who worked with me for 6 months. She was 28 years old. Her chronological age is 28, but biological was 41.
Wow.
So cell health was poor, but that was after 6 months. And people go, wow, she worked for 6 months and got there. Yes, but you have to understand, she told me if we started there, she would not have even been able to finish the test.
Right.
So what we get from that is how many calories do you need in a day? Okay, great. I don't get too number specific, but if I have some metrics, we might need to bring that in to just give you an idea. But it gives me, what are your training zones? So when people have either performance goals or severe weight loss goals, we can use that to say, look, we need to modify your treatment based on your exercise routine should be this over the course of a week. Going back to the 20 minutes a day isn't enough deal.
Right.
And so we can say you need to lift here, your heart rate needs to be here. And from there, we can then retest and show improvements in oxygen utilization. You mentioned earlier, people ask about hyperbaric oxygen.
Yeah.
That's delivering oxygen at a high pressure in a liquid form to help the body heal. Well, if your ability to use oxygen is really poor, we need to design training to improve that function, right?
Rather than flood the body with a lot of oxygen.
Right. So let's train the body to use what it has more efficiently, and the more efficient you become, the healthier you become. So VO2 max testing has a lot of clinical implications, and because people have been so data driven, and we tell them they need a lab test, which lab reference ranges, if you know nothing about those, are not as specific as you'd like to think.
Right.
But because they're data driven, and we're not saying here's a lab, we're saying here's your result. We don't compare it to somebody else. That's another thing I like about this. It is not comparing you to your neighbor or anybody else. It's saying, here's where you are, here's what function is good, here's what function is bad, and here's what we need to do to correct it. Well, guess what? Vitalism is changing the function of the body. I am simply now quantifying it using VO2 max testing. And then the other piece that we brought in with technology is body composition analysis. Now, body composition analysis used to be these little handheld devices 25, 30 years ago, and the quality was terrible. They were not very reliable. They have improved so much that there are now, I have what's called the InBody 580, if anybody wants to look at it. It is a clinical version of a metabolic or a body composition analysis. They have another one that's a step up that they are using in dialysis centers because they can measure the fluid in the body so accurately using that device. And it's non-invasive. You step on a scale that has these electrodes. The body composition, I don't care what the numbers are when we start. We simply use it to show progress. Because
what does it tell you? What is it?
So it'll give us, so it's going to give me body fat. It'll give me how much water, what's your hydration? Are you over or under? It will also tell me how much muscle mass do you have in each arm, each leg, and the torso. And it'll give me an estimated caloric need for the day, which again, I don't get too concerned about that. But because of the segmental analysis, so arms and legs and torso, I have seen patients where certain numbers are high and it says we have inflammation in that segment, which is why the body is off. So you're like, man, I can't figure it out. Well, we got an injury. Or they won't tell me, and I can look at it and go, have you had an injury here? Well, yeah, I've got a problem because it's holding water. But how many times do people come in and go, oh, the number on the scale didn't change because they're fixated on a number?
Yeah.
And now I can show them, you're right, but your muscle mass went up and your body fat went down. And we can see that your arms are now stronger than they were, and your legs are stronger than they were. And that is a motivating factor for people because it's to them, it's not based on anybody else. So when we use these, it's numbers specific to them rather than a comparison, because everything we do is individualized. It is not it. So that's where I'm using technology that makes sense along with your diet and lifestyle changes. And that just gives you the feedback. Yeah, okay, I get it. Now I understand. And we're looking at all these metrics using food, herbs, water, right? All of those things to build those pieces.
Yeah, I think it's you touched on something really important there. People need to see that things are changing even when they feel better. And I've often been very curious about that. You know, they want to rerun a test or do this to sort of prove to themselves that their body is indeed changing. Like I'll have somebody who's had insomnia, you know, GI issues, chronic headaches, chronic joint pain, like skin issues, say, you know, 6 to 8 months go by and all of those issues are gone. Like gone. They're jumping out of bed. They got energy all day. There's no pain. Haven't had a headache. And they'll say, well, shouldn't we rerun the test to make sure that everything's okay? And I'm like, if you really want to spend the money on that, I'm happy to order the test for you. But is the evidence not in your daily experience? Oh, I feel great. I feel 20 years younger. I feel like I don't even feel sick anymore. And I'm like, is that not enough proof for you? You really want to run the test? And some people do. So I understand the diagnostic stuff. Yeah.
Yeah. And that's what it is. And again, so the reference ranges on labs I mentioned earlier, if I go to LabCorp in Spokane and LabCorp, Florida, same lab, different reference ranges.
Oh, yeah.
So the labs just, that's why I like what we're running, because it's completely specific to that patient with no comparison.
Absolutely.
So we can just say, okay, if you do these things and we recheck you, because some people want to retest the VO2, like, oh, did my VO2 get better? Okay, I understand that, right? We know it's going to be better if you feel better, but sure, we can rerun it. But the advantage to the VO2 max rerunning it is if you did improve enough, we now need to change your training to match the improvement. So there is some functional utility in rerunning that one. And the body composition is just so somebody stays motivated. And if they start to slide, they can go, ooh, I don't like my lack of muscle. So, and I've done that with myself. I run it and I go, not happy with that. I need to reevaluate what I'm doing. And I can catch that before it gets too bad.
Right. So do you think, how long have you been in practice now?
I've been seeing patients for 11 years.
11.
Almost.
Okay. So is it your experience that people are becoming more aware of this paradigm of medicine that you and I live within? Are they becoming more aware of it?
Yes, with the caveat of, so first, yes, and COVID really spurned that.
Yes,
the distrust in the medical system. At first, people thought we were crazy. The people watching this, if you want to Google and see, and the reason I say it now is it's kind of funny. It wasn't at the time, but it is now. I used to be on the Board of Health in Spokane. I was the first naturopath appointed to the Spokane Regional Health District. And so that was right before COVID started. I got appointed at the end of 19, January, February, in-person meetings. COVID hits in March, and all of a sudden we go virtual, just like everybody else. And at the time, I had no idea what this was. And I was like, well, I need to figure this out like everybody else. How serious is this? What is this really? And then really within a few weeks, I was like, this is ridiculous. It didn't take long to figure that out.
Right.
May 1st in Spokane, we had a mask, we had a protest, a May Day protest in Spokane. And I ended up on the front page of the newspaper because I called into question the mask mandates. And I'm on the board of health, so that didn't look good. Everybody was angry, blah, blah, blah. So it was really a political hit piece because there was a politician that was up for re-election, and he said, my good friend, and I know him, but he wasn't a good friend. It was just the language he chose to use. And so they wrote a 1.5-page article, like full inside newspaper page. Like it took the whole thing and went on and came off the front page. If you Google me, you'll find that article. So I love to point it out because everything I said was 100% accurate.
Oh, yeah.
Vitamin C showed efficacy. The masking, CDC, WHO didn't agree. So anyway, the point is that when COVID happened, people at first were like, oh, you guys are crazy. And then as more information came out, they realized you guys aren't crazy. These guys are lying to us. They're manipulating, which they've been doing for decades. So yes, more people are aware of, they need something else. But a lot of what they're aware of is functional medicine.
Yes.
Which is what I was alluding to earlier.
Yes.
And so that's why I think it's a good inroad. And I don't have any, I think functional medicine serves a great purpose as a stepping stone. I have a mentor, Dr. Jared Zeff, and he always said, primary care is the first point of entry into the system. I look at functional medicine now as the first point of entry into the alternative system for a majority of people.
Yeah.
And that can be enough for some people. Because some people, that's enough for them, which is still a better alternative than what the system offers. But a lot of the time, I don't think it's as good as what we offer.
It's still different. We still offer something different.
Right. We have because it's not the tool that you use, it's why you use the tool. Right. And that is really hard to teach unless you understand the philosophy. And that's the functional medicine side doesn't have the same philosophy that true naturopathy and vitalism has. And that's not faulting them. They came from a conventional system. So now they realize this system is broken. I need something better. Oh, I can use berberine for blood sugar instead of metformin, right? And yes, we need to change your diet. So we're going to run a food allergy panel. And so we can see these allergens are there. And so don't eat this. And those things are all great, right? The late Jim Sensenig used to say, he would run those, and he's got colleagues, and Dr. Zeff will say the same, that use within vitalism different approaches to food, and they get great results because of how they philosophically apply the entire package. Right. And so again, there's a lot of really good functional practitioners out there, but they're very different than what I do because I really want people to understand the lifestyle components of what you do, what you think, what you say, because everybody has ups and downs, right? And we have to make sure we understand how that down affects your health.
Absolutely.
So I know I go all over the place. I'm sorry. I'm so tangential.
Okay. That's why I was so looking forward to chatting with you. So folks, we're coming up on our hour, but I want to remind you of some things. And then while I'm saying these things, I'm going to ask you for a final message to our listeners, Dr. Kinley. So remember that it's a journey and it doesn't matter where you're at. Restoring health to your body, you simply have to take a step, whether that is consuming more water today than you did yesterday, or not drinking that soda pop and things like that. It is so much easier to do this when you have a partner, and a naturopathic doctor, in particular a vitalistic naturopathic doctor, makes a great partner to help you walk this path. For some people, it's fast. For some people, it takes time. And it's really finding that person that you trust and that you can just sort of fall back in the, figurative arms that they hold out to catch you and help teach you and walk you through this, but everybody can be healthier than they are. And when that happens, you don't have symptoms of illness because your body's not sick anymore. So, any special words of a message that you'd like to leave our listeners today?
It's never too late to start, because you can always improve the quality of life regardless of where you are, because you're never guaranteed the amount of time. So if you're going to say, I'm going to wait until, you're going to wait until what? You're so miserable you can no longer make a choice because you're now forced into something you didn't want. So you always have the choice. Choose your hard. Being sick is hard. You're symptomatic, you're on medications, you don't feel well, you can't do what you want, you don't enjoy your life. Being healthy is hard. You're making different decisions, you're exercising, you're taking care of yourself, and you're bucking against the trends, right? Or what's out there in the system. Either decision is hard, and the choice belongs to you, and you have to accept that the choice is yours. It doesn't belong to the doctor, and that includes me. It is not my choice for you, right? Your choice. Choose your hard.
I love that. Thanks so much for taking the time out of your busy day to chat with me. I'll see you in a couple of weeks.
Yes,
and
you
for
will.
all of you, thank you for being here and listening to Vital Wisdom. You can always send in your questions and we'll pop them on the air and answer them the best that we can. And hope you all have a great day.
Thanks.
Thanks for joining me today. For those of you who have written in, emailed, and are interested in my books and other offerings, I wrote The Unvaccinated Child as a resource guide for parents and caregivers to navigate childhood illnesses in a natural and healthy way. And while the intended group was the unvaccinated, it turns out it's an important resource for the vaccinated kids as well, since vaccines do not necessarily prevent illness. Smoke Rings is another book I wrote, and that's to help smokers support their health, regardless if they plan to quit or not. So for people who smoke, love a smoker, used to smoke, continue to smoke, this book helps you be your healthiest version. And when I say it is judgment-free, it is absolutely judgment-free. You're free to make the choices you make. I'd just like you to find better health while you make those choices. My most recent book, Homeopathy, A Foundational Approach, is really great for someone, whether they're a complete beginner or they've already been practicing homeopathy. It starts at the beginning and it guides the readers through the basics and on into first aid and acute practice, so you can start using homeopathy right away. That's the most important thing to me, is to get folks using homeopathy in their everyday life. My workshops and courses can be found at either ecampnd.com or longshadowsranch.net. Have a great week. Again, thanks for joining me and thanks for your support.